During my first year in my grad program, I was first diagnosed January 2018 with Hodgkin's lymphoma. I was diagnosed with stage 4 at the time, so they believed that I had my cancer for up to a year before it was caught. And I started a 6-month regimen of chemo treatments, January 2018, finished in August, and now been in remission for 2 years. The part that I remember battling with the most was I was tossed around from doctors because I was an undergrad at UNC, so I was at campus health. So they very much viewed me, and I was in the notes as a child. And then by the time that I started needing to see a doctor again, I was an adult. So by the time I got to somebody telling me that I needed to see an oncologist, it was shielded from me in a way that made me feel scared, even though it didn't have to be that scary in the beginning. So at the beginning, you're very much in the management type role of your treatments and your whole diagnosis, and it's all about the logistics essentially. You're told your medicines, what you can and cannot do. And then there comes a switch where I guess the heaviness, the realness kind of comes in, and you realize that parts of your life are about to change, and they have to change. You don't get to control it. You do get to decide. You still have your autonomy on that, but it's not going to look like what you thought it was going to. And so there was a point for me in that when, during my treatments, I had the unfortunate event of having a seizure in the beginning, and that was when things completely turned for me, because the way that everything was explained to me, it seemed as if I was trying to force my body to keep up with a normal without listening to what my body could keep up with. It was at a time in my life when I was diagnosed, getting to grad school at UNC, living on my own. I had a job where the job reached out to me. I didn't even apply. I felt like I was on the mountaintop that I was supposed to be at 23. And then within the matter of just one afternoon, I woke up in a hospital. I could not wait for the day that my treatments were ending. I had that day in my calendar since they first gave me my diagnosis. It was even postponed at one point because I was sick, and I thought that was the end of my world. But when that day came, nothing went away. Nothing. The day comes and the day just comes, and you don't have to schedule a follow-up chemo appointment. That's the only difference. And I jumped right back into school 2 weeks later. Jumped right back into management type role of my life. I was like, okay, I got this. I'm just going to go back to where I was right before all of this. Set up my classes, registered with accessibility services, got into it, talked to all my professors. I had extension deadlines, all of that. And I just never felt happy. It just never felt that excitement that I thought I was going to feel when treatments were done never came. And it started getting worse and worse. That was when I had to make the decision that the choices that I thought mattered to me were not helpful and were actually hurting me. And I had to completely change my, desires for what I wanted to live and do for that time period in my life, and just focus on myself. After my treatment was when my mind was like, hey, you have to be 100% focused on you, your body, and what it needs, mentally and physically. And it's the mental healing that was the hardest for me. I discovered that I wanted more focus. I wanted to use my skills in an area that now matters to me in a much bigger way than my undergraduate degree mattered to me. So I'm now actually doing my master's thesis on the topic of adolescent and young adult cancer patients' resources, and particularly a repository of those resources for them to be able to access them in a way that patients need to access the resources. That's kind of how I came to terms with my cancer diagnosis, was letting it focus and refuel my drive in life, versus letting it define where I was going next. If that makes sense.
Yeah. Can you expand a little bit on just like what we were talking about yesterday?